Hi, I'm Dr. David Geyer, orthopedic surgeon and sports medicine specialist, and I provide education and commentary on sports and exercise injuries, injury treatments, injury prevention for athletes and active people, probably much like yourself, so that you, your kids, your friends can stay healthy and perform your best. Now, one of the questions I get a lot after somebody has a significant injury is, should I try to get back to whatever the sport is that you like to do or the exercise that you like to do, or should I give it up because I'm afraid that I'm going to suffer the same injury, or maybe I'm going to do more harm to it? And so in today's Ask Dr. Geyer video, I'm going to answer that very question from a mother who's concerned about another serious knee injury for her son. Angela asks, "My son tore his ACL non-contact on the third day of football practice his junior year. Then, in his senior year, he tore his other ACL during the second football game. His dream of playing college football was crushed. He shared with me today that he would like to play again, but he's afraid of a third injury. Is it true that some people are prone to ACL injuries more than others? When should an athlete call it quits?" Well, Angela, that's a terrific question, and really there's two parts to that question, and I don't know that there's an absolute right answer, but let me at least give you my thoughts on it. First of all, are some people more prone to ACL tears than others? The answer to that is yes, we think that there are. First of all, there's thought to be a family risk that if you have a family member that's torn his or her ACL, you're more likely to tear your ACL. But there's other thoughts about it. There's thought to be hormonal factors for the females. There's thought to be neuromuscular factors, how athletes land from a jump, the position of their knee when they go to turn, the relative strength and firing patterns of the muscles around their hips. There's a lot of different factors that play a role. There's anatomic factors as well. So there are certainly people that are more at risk for injuries, and that's where we've had we've put a lot of work in some of these ACL injury prevention programs, especially with the neuromuscular risk factors, the landing patterns, the muscle firing patterns, to try to correct those muscle firing patterns to basically minimize or at least lower your risk of injuries. But it's an absolute real phenomenon when you have somebody that's had one injury. Are they more likely to suffer a second injury, and maybe should they quit altogether? And I could answer this on a number of different injuries, but specifically with ACL tears, there's a couple factors worth discussing here. One, we know that the return to sports rate is pretty good after ACL reconstruction. Somewhere, 2/3 to maybe 3/4 or even a little bit higher do get back to playing sports at the same level of play. It may take a year, may take a little bit longer, but it can be done. It's surgery, it's a lot of work, but it can be done. We know that those risks after a second ACL surgery, at least to the same knee, would be a little bit lower than a primary. It's hard to tell exactly how much lower because there's a lot of variables, but it is lower. Now, what she's asking about, her son's had an ACL tear on each knee. And it's very common. Injury to the opposite knee's ACL tear is a known risk after an ACL surgery. But if he injures it again, now you're talking about a revision reconstruction on the same knee. So if he were to make the choice, I don't want to take that risk. I'm going to do weightlifting, I'm going to run, I'm going to do a lot of physical activities, but I'm going to give up competitive sports. Nobody would really blame him, that's for sure. But the counter argument to all of this is what we do in sports medicine is to try to get people back to the sport or the exercise that they love to do. And so, we can certainly do that after a revision ACL reconstruction if somebody happens to suffer a second ACL injury to the same knee. It's a bigger surgery, no question. It's a lot longer of a rehab. It's a lot harder work, but it can be done, and there's a lot of people that's really what they want to do. I mean, if you go to the NFL, there's a lot of people that have had revision ACL reconstruction. So I would never say it's impossible, and if somebody came to me and said, hey, I've had both ACLs, I want to try to go back and play, and I'm willing to risk having a third, it would really be hard to fault that person. Maybe you suggest one of those custom ACL braces. We know that those don't completely prevent the risk of an ACL tear, but maybe it lowers that a little bit, but you would at least try to let them get back to play. That's what we do as orthopedic surgeons and sports medicine specialists, is we try to get people back to to the sports and exercise that they love. Now, have you had a serious injury? Maybe it's an ACL tear or labral tear of the shoulder or rotator cuff tear, where you are really concerned about going back to maybe running or soccer or football or basketball or whatever it is you like to do. And did you try to do it anyway, or did you retire because of your injury? I would love to hear your experiences. So share your comments with me below this video. Leave your comments. I'd love to read them, and I'll try to respond as well. I'd love it if you'd share this video with your friends. If you have people that are dealing with this very question, hopefully this video can be helpful for them. I would love it if you like videos like this on injuries and injury treatments and injury prevention. Subscribe to my video channel. I record 1 or 2 of these videos a week, and they get delivered directly to you. And last, I share a number of resources on ways to stay healthy and perform your best in whatever your sport or exercise, and I share them completely for free with my email list. So go to my website, drdavidgeyer.com. You can sign up and get these resources, delivered directly to you completely free. I love to reach out with people that way. Thank you so much for watching. I hope this video was helpful, and I look forward to seeing you right here next week in our next Ask Dr. Geyer video.